used to get calls all the time from people asking me about the station. What kind of music do you play? And the canned format was adult album alternative. And so I asked the music director, what does that actually mean? And he said, we play the good stuff. That was the end of his explanation.
Well, AAA music is heavy on the singer-songwriters and the Americana, but we also include blues music, jazz, other styles like world music.
It's not the same songs every other hour. And in 90.5's case, it's not even the same songs each week.
WCB is pretty unique with all the variety of music that we can play and the variety of shows that we have.
We've had John Prine, Ziggy Marley, Warren Haynes from the Allman Brothers. We have had Tedeschi Trucks. The list goes on and on.
The thing that we have at WCBE is experts in music that know where the good stuff is.
Homemade, locally produced programming is what we're all about, and just sort of sitting there and grooving out in a radio station, knowing that I'm doing the same thing with thousands of listeners across the state. I really dig that. I dig that sort of concept.
We're all over the map. It's great music. You know, people that go, oh, I listen to everything. If you listen to everything, all you need to do is listen to us.
remember 12 days ago.
That's all right. No worries.
Yeah. Well, it's very nice to meet you again.
Thank you.
I will do it.
Well, good afternoon. Welcome to the January 25th, 2024 Audit and Accountability Committee meeting. Auditor O'Connor, please call the roll.
Okay, Ms. Vera,
Here.
Mr. Grant. Here. Mr. Vajan.
Here.
Ms. Reyes. Mr. Jordan.
Here.
Mr. Daniel.
Here.
You have a quorum.
Thank you. This afternoon, colleagues, I'll have the, let's see, here we have our committee operations, Office of Internal Audit Report, Risk Management, and I will hand it over to Auditor O'Connor.
All righty, first thing we'll do is approve the minutes. So did everybody get a chance to look at those minutes? Any changes that need to be done? Okay, I'll just, guess we need a motion to approve.
So moved.
Second.
And Ms. Vera,
Yes.
Mr. Grant,
Yes.
Mr. Vajan,
Yes.
Mr. Jordan,
Yes.
Mr. Daniel.
Yes.
Motion carries. And then we'll get into committee operations. First thing on the agenda is committee realignment discussion. The board seated 2 newly elected board members at their January 9th meeting. So board members have not been appointed to the Audit and Accountability Committee for this year at this time. So we'll have those appointments before the next scheduled Audit and Accountability Committee meeting. And then we'll move right into committee charter. We sent out 3 committee charter documents. The first one was the most recent committee charter approved by the committee in April of 2018 and adopted by the board in May of 2018. Then we had one because at the time, the board wanted all the committee charters to look similar. So there were edits made, and that is the second document we sent out that's in track changes. That was 2021, and the board submitted that to everybody to look at. It was never acted upon at the board level. And then we sent out a clean copy of that, so it's easier to read. So I just wanted to get those in your hands so you can start reviewing those. We won't take action this meeting. In March, when we have a full committee, we'll bring that back up for consideration. And again, we'll get some input from the board on the direction of those committee charters at that time. Any questions on that? Okay, Madam Chair, I'd like to request that we move the risk management part of the meeting up to this point of the meeting so we can have staff deliver their presentations and then do the work that they do.
Is there a motion to move up the order? What was the committee?
So moved.
Is there a second?
Second.
Okay. Ms. Vera,
Yes.
Mr. Grant,
Yes.
Mr. Vajan,
Yes.
Mr. Jordan,
Yes.
Mr. Daniel.
Yes.
Motion carries. Okay, so we'll start with the COOP plan update, and that will be delivered by Director of Safety and Security, Chris Baker. There's a policy, a board policy 8300, that talks about a requirement for the superintendent or designee to review the COOP annually. So Mr. Baker was gracious enough to attend our meeting and go over those COOP plans for us.
Yes,
Mr.
thank
Baker?
you. Thank you. Good afternoon. As I've shared with Kevin O'Connor, what we're doing in the Office of Safety and Security as it relates to the COOP plans, we are actively reviewing those plans, and we have a plan to ensure that all of our new directors and leaders of each department within the district are trained on the COOP plan and presentation processes. We are partnering with Tetra Tech, who has already been part of the district before and trained on the importance and the development of those COOP plans, and we're waiting to find out the specific location in order to deliver that training, whether it be in a large core meeting or through some kind of video conferencing to ensure that all of our leaders that are over each of our departments have an opportunity to understand and develop the COOP plans for their areas. We are also identifying those new leaders and positions that they've assumed to ensure that we have the active roster in order to train those individuals.
Any questions? righty, thank you, Mr. Baker. Next up will be a food services update by Director of Food Services, Joe Brown.
So we have a short presentation, a few slides. There we are. Thank you. And thank you for allowing me the opportunity to share. So we're proud of the work we do within food service. We do realize and take very seriously that a well-nourished child is better prepared to learn in the classroom, and we understand very clearly how we fit in to the district goals in that regard. That being said, we always know that there's opportunity to improve, and we strive for continuous improvement as well. So just a little bit about us for those of you who don't know. We have two models within our school district. So our elementary schools, we use what's called a heat and serve model. So we have a food service production center at 450 East Fulton that packages food in kind of individual portions. Those are sent out to the elementary schools, and they're reheated. They also have fresh fruit and offerings bars in those schools. So they have typically 2 fresh fruits, 2 the fresh vegetables a day to supplement that entree that comes across. And they get a choice of 3 entrees in the elementary schools. Our secondary schools are more like traditional kitchens. They get shipments brought in directly from the suppliers. They cook and prepare the food right there and take care of all that. So again, those are our 2 separate models. We do provide over 50,000 meals a day. And we have over 370 staff people to do that. The Food Service Fund, most of you are probably aware, the Food Service Fund is designed to be a self-sustaining fund. So the reimbursement we get or the costs that we charge out are to cover all of our costs. The goal was to not receive funds from the general fund. And I'm happy to say it's been 10 years since we've had to do that. Currently, we have about a $30 million budget, and at the beginning of the year, we had about $15 million in our fund to start the year. So from a fiscal standpoint, we've been doing pretty well. One of the things that's aided in that, and one of the things that's aided us overall, is the community eligibility provision. All students within Columbus City Schools are offered free lunch and free breakfast. Very important. We didn't have that opportunity before 10 years ago. This is our 10th year in that program. It was a change made by the USDA, and luckily we qualified for it, and it made good sense for us. Where this really helps is 10 years ago, we had staff that a large part of their focus was on collecting applications from kids and collecting and monitoring money. Now, that isn't their focus anymore. Now their focus can be on service, quality, those types of things, which has made a huge difference in the service that we're able to provide toward kids. So as much as, many of our costs are variable, but like many places in the district, we don't flex very quickly. And so therefore, ultimately, meals are the biggest driver in our profitability. In theory, if you serve less meals, you use less staff, those sort of things, and you adjust. And in the long term, that does happen. But you don't necessarily make those adjustments for day to day or even month to month. So again, participation in meals are our biggest driver. You'll see on the charts there that we're very happy with our meal services this year. That's last year versus this year. The darker columns are this year, the lighter columns are last year, and you're looking at breakfast meals per day and lunch meals per day. We see about an 8% increase in breakfast meals per day and a 7.6% increase in lunch meals per day. We do strive, we benchmark those numbers as well. We strive to be, based on the Council of Great City Schools benchmarks, in the top quartile. For breakfast, we are in the top quartile. For lunch, we are just out of the top quartile. We're in the top third. So we have some opportunity there to continue to improve. But that is where we like to, when we look at all of our benchmarks, our goal is always to maintain the top quartile. One of the other areas of focus for us over the past probably 2-3 years has been absenteeism. It's one of our challenges. In order to make sure we take care of kids, we have to have the people there to do it. And we've put a lot of focus in absenteeism over the past couple of years, as has the district as a whole. And we are very happy to see that if you look at last year's call-off hours, Kronos can be a little challenging to compare absenteeism one year to the next. So the way we did it is we took, okay, how many hours are being called off? So we have 3-hour employees, 5-hour employees, 8-hour employees. If a 3-hour employee, if a 6-hour employee calls off, that counts twice as much as a 3-hour employee based on this measure. But it's a good way to do it because it probably hurts you twice as much when a 6-hour employee calls off as opposed to a 3-hour employee. So we have been tracking those hours, and like I said, we've seen a 15.1% decrease in declines month after month. So we hope to see that continue. So we do have some initiatives going on in food service, but our primary initiative right now is a food service information system implementation. That system was boarded in May. So after that hardware was ordered, software was put in place. We are working through that implementation this year. There's really 3 parts to that information system. One is point of sale, so it's your registers. Wherever you go, it's the person who accounts for meals and such at the register. On the back side, there's production records. It's how many meals did you produce? How many did you serve? Those are the records that help make sure you prepare properly the next time based on what you did this time. And then finally, there's ordering, receiving, and inventory. These systems can help you determine if this is what I have in my rolling inventory, and I serve this many, this is how many I need to order next time. And that all goes together. We are working our way through that process. We expect to be implemented 100% before the start of next school year. Implementations are a little challenging during the school year, but we're working our way through pieces of it. And the Internal Audit Office has offered their support and help to ask any questions they might have on the front end. So as we're building this and we're working through this, we work together to determine where our risks are, and hopefully we're able to mitigate those on the front end as opposed to catching them on the back end and having to rework things. Risk. So there's a couple risks that are listed. I listed kind of what I consider our 2 biggest risks. The first is food safety. I said at the beginning of my conversation that we take very seriously our opportunity to make sure we have well-nourished students in the classroom so they're prepared to learn. If we make them sick, we just went the opposite way of what we're here to do. So with any food service institution, food service safety is taken very carefully. We do have a number of strategies we utilize to mitigate that risk. All of our staff, 100% of our staff, have food safety training on how to handle food, how to make sure food is served at proper temperatures, that sort of stuff. We have ServSafe certifications. So within all of our schools, there's at least one person who's certified in food safety. And in many of our schools, it's more than one person. We do audits, both self-audits by our staff in our school and supervisory audits where they go out and verify what our staff looks at to make sure that everything's done. And finally, Columbus Public Health is a great partner of ours, and we get 2 health inspections a year at all of our locations. And they have a regulatory arm within Columbus Public Health, but they really are a partner of ours. If we have something we're not sure about, if they have something they hear, we're on the phone immediately. We talk to each other. We try to figure out what the best solution is. So they, like I said, they have a regulatory arm as far as we're concerned, but we truly look at them as a partner. The other area is really around meal claiming. So we have a obligation. The vast majority of our funding comes through the state and then the USDA. And through that, we have to claim the number of reimbursable meals that go through the lines every day at the schools. That is an opportunity for error for us right now. Our point of sale system is helping reduce that and mitigate that risk. And we have put systems in place to limit that risk. But we do know that's an area of risk for us. And it is our expectation that once the point of sale system is 100% in place, that I won't say it's nothing that we have to worry about or don't have to worry about at all, but it'll be strong systems in place to reduce that risk and keep it very manageable. The last thing I have on here is just potential future risk. Changes in federal requirements. They're always possible. Truthfully, depending on the administration, if it is a more conservative administration, they want to typically decrease funding and reduce regulations. So it's kind of a double-edged sword. We like the decreased regulations, but we don't like the decreased funding. If the other side of the house is in charge, they typically want to increase funding. They want to provide more funds for us to be able to take care of our kids. They also want to increase regulation to make sure we're handling those funds properly. So pros and cons with both scenarios, but that's typically what we see, and that can change with whatever administration might be in charge at the time. The other one is supply chain. We've seen a lot less issues with supply chain this year than we had the past couple of years, much more manageable. When we saw those issues with supply chain in our schools, typically food wasn't the biggest issue because although we don't like to change menu items, if we publish a menu, we like to stick to it. We always had something where we could, if something didn't come in on today's truck, we had something we could pivot to and still take care of our kids. Disposables is where we ran into our most trouble. I mean, we had situations where it was Tuesday and we knew on Friday we would be out of that, we didn't have anything left. And it's difficult to serve meals without a plate or something to put them on. But we worked with a lot of local partners, and we always found a solution. We keep a few more of those on hand than we used to, but that has not been an issue this year. But it is still something that we, based on previous experience, keep an eye on. So that is all I have for you. I'm open to any questions you may have.
You mentioned one of your risks is related to food safety.
Mm-hmm.
Have we had any issues related to supply chain issues from food safety?
So depends on how you define that. So on very rare occasion, we might, I'll give you an example. It's more of an, probably 3 months ago, an elementary school had a chicken tender and there was a bone inside one of the tenders. So we'll see something like that. So when that happens, we go back to that supplier, we save the product, we go back to the supplier, we ask them, we ask them to verify what it is, ask them what they're doing to prevent that from happening. On occasion, we found things and we've sent them to, we have an independent lab we work with. So if we have questions where we want to send something to an independent lab, we have that opportunity. We haven't had the need to do that in a while, though.
So just thinking that might be something you'd want to list on there if you're looking at your suppliers and tracking safety from their side.
Fair enough. Thank you.
Just in terms of equipment,
Yes, sir.
any issue? I mean, things wear out over time. I mean, how long, is there are you monitoring the age of the equipment and, in terms of when you might have a major equipment purchase need or whatever?
So I would love to be able to tell you we had a robust, very, detailed equipment replacement program, but I would be fibbing. We do not. We do replace equipment as it goes bad. There's kind of two sides to that. There's the smaller equipment, refrigerators, ovens, things like that. We work with our vendor that does repairs and determine if things are beyond repair or not, or whether they're, and when that happens, we replace them. And luckily, we are in a fiscal situation where we're able to do that. Larger items like walk-ins and such, we have a number of schools where, to be honest, we haven't replaced walk-ins in schools in my time here in 15 years, before a couple years ago. Part of that was when I first got here, we weren't in a fiscal situation to do it, but the ones, we're holding up. Well, now we do have that area we do have a better plan. We had an organization come in, go through all of our walk-ins. They ranked them and rated them based on which ones should be replaced first. The first year we only replaced 2 because we were learning. We did this over the summer. That went well. Last year we replaced 6, actually, and the board meeting that'll be the first meeting in February. We have 6 more to replace next summer. And what we do is we work through that list. We take that list, we look at it, we evaluate, has anything changed? Is anything, to determine which ones we need to focus on? But we're working our way through that list.
Appreciate that.
I have a quick couple questions.
Yes, ma'am.
In terms of our food quality, how do we go about, tracking or, getting specifically, I guess I'm interested in, are students a part of, the process for collecting food quality
They are.
information?
A couple different ways. So one of which, the simplest ways, we have student surveys where students can provide feedback to us based on the things they like, things they don't like. We do student taste testing, and primarily that's around new menu items. So we will go to different schools or different locations, primarily ones that have asked us if they can be a part of that process. We'll set up for lack of a better word, a small food show. And they go through, they try different items we're considering, and then we, based on their feedback, we make changes. And we've, 100% of the time I've been here, we've used that. We don't bring anything to them that doesn't meet the USDA requirements. It's got to meet that part. So by the time we take it to them, we really want their feedback and have made numerous changes based on student feedback.
Great. And how often does that happen? Is that something at the beginning?
So we
of
make
the
menu
year?
changes twice a year.
Twice a year.
So we'll typically make them at the beginning of the school year and then after the winter break. So we just implemented new menu changes. We will start very soon to start to work on the changes that'll take place next school year, because in order to have supply chains set up and all that, we have to have those decisions in place probably by May in order to make sure everything's here by the first day of school.
Great. My next question is in regards to food waste. I assume we track our food waste. What does that process look like?
So we do through our production records, what was used, what wasn't used. The systems we have in place currently it's not easily quantified at the district level.
Okay.
Our new information system will make that information a lot more reasonable to get. Right now, it's a matter of going and gathering paper from schools, compiling it. So we don't do that often unless we see a problem. And ways we identify problems, say you have an elementary school, we track how many meals they order on a given daily basis, and say they order 400 entrees every day, but they're only serving 280 of them. Well, then there's something wrong there. We typically want them to be, we don't want them to be right on because we want every student to have every choice, but we want them to be within 5 to 10% of their sales. So if, if there's 300 kids being fed, they should be ordering somewhere between 315 and 330.
Okay, thank you. And then I was really impressed by the decrease, the 15.1%. For your call-offs, I believe. Is there something that you've identified that's attributed to that decrease, or just anything you can highlight as to how that happened?
Nothing that's been validated, but here's my opinion. We focus on it. We have a number, some of it is just relationships between frontline supervisors and staff, that sort of work. But the biggest change that's taken place between last year and this year is a change to the contract, where employees are offered a monthly attendance bonus instead of a semi-annual attendance bonus. And if I had to guess, I would say that is the thing that had the greatest impact on our improvement in attendance.
That's important.
Yeah, I mean, we'd have to look at it classification-wide to probably know that for sure, but if I had to guess, that's what I would attribute most of it to.
Great. And my final question is in regards to our inventory. Are we tracking when we receive bad quality food from our vendors? What does that process look like if things are arriving that we can't serve?
We do. Doesn't happen often, but it does happen. Typically, or ideally, we refuse at the time of delivery. So they get, because our food gets checked in, the staff sits there, they look at it, they say, no, this isn't good, you need to take this back. So that's typically what happens. There are some exceptions to that. You know, we, like at the Food Service Production Center, we receive a full truckload of food. You're not checking every case as it comes in. So in those situations, we have relationships with our vendors where they'll credit us for that. They'll replace it if need be. It kind of it's determined a little bit by what we need from them. If it's a school and it's milk, well, then they need to replace that because they need it for their students almost immediately. If it's something where we ordered, 300 cases of something and somebody drove a forklift through part of it and we didn't see it as it comes in the door because it's all shrink wrapped, we would collect that afterwards. Doesn't happen a lot, but it does happen.
Thank you.
Thank you.
Alrighty, thank you, Mr. Brown.
Thank you.
Appreciate you. Okay, the next one is a Medicaid update, and if you recall, back in May of 2022, we did a Medicaid project, and Dr. Floyd, myself, and Mr. Dan Thomas presented that to you. So Dr. Floyd wanted to come in and give an update on that Medicaid process.
All right, I'm going to try really hard to condense a really comprehensive project overview. As I look around, I don't think many of you were at that presentation, so it's your first time hearing it. So my backup plan was to have some detailed notes, so my sincere apologies for reading the notes, but I want to make sure that I'm able to at least explain and clarify some things that is a follow-up to the original presentation. So as Mr. O'Connor stated, that I worked collaboratively with his department as well as our third-party vendor, Healthcare Billing Systems, to more or less do an overview in response to what extent are we leaving money on the table with Medicaid returns and what are we eligible for and what aren't we doing. So with that, we did this presentation. We looked at various areas. We even followed up with a Lean Six Sigma project. So a lot of good things have come out of this. But in short, back to the beginning of that project overview, there was an executive summary. That's just a couple of pages. That's really easy to follow. We, in short, this executive summary recommendations were as follows: to have dedicated staff charged with coordinating and monitoring Medicaid work for the district and lobbying the Ohio Department of Education, the Ohio Department of Medicaid, and legislators for services and funding that other school districts and/or states are receiving. The dedicated staff could help ensure that district services provided are being documented and submitted to our third-party vendor, Healthcare Billing Systems, I'll refer to them as HBS, in a timely manner, and that all services meet the necessary criteria to be eligible for reimbursements. Being the largest school district in Ohio, Columbus City Schools needs to be at the table to be able to advocate for acquiring the maximum resources for our students to enhance the whole child vision adopted by the district. And I think that one has multiple pages, but the objective that we had for the project overview is to determine ways to close gaps limiting the district's Medicaid funding opportunities and efforts to enhance the whole child focus, which now it appears that politically correct statement is WSCC, which is the whole child, whole community, and whole school, whole child, and whole community as a focus. So it continuously evolves. The next slide, and I think this one, it should say the Centers for Medicare and Medicaid Services. Do you have that slide? Should be slide number 3. The Centers for Medicare and Medicaid Services, or CMS, has released a comprehensive guide for expanded Medicaid services and administrative claiming that was developed in consultation with the U.S. Department of Education in support of Medicaid healthcare services in schools. The guide offers new flexibilities, making it easier for all schools, no matter their size or the resources available to them, to receive payment for delivering Medicaid-covered services. Schools are a key, but often an overlooked setting for health access and equity. Examples of expanded care that can be delivered at schools include the following: preventative care, such as school-based health clinics, which we have, yay. Behavioral health, that is inclusive of school counselors, social workers, and school psychologists. The ability to provide extended physical and occupational therapy aside from IEPs, and disease management such as immunizations and dedicated nursing services. Currently, expanded school-based services have not occurred in Ohio. However, Columbus City Schools has a great opportunity to be a part of the conversation, as well as we are perfectly positioned to share options and considerations for future state plan amendments. CMS has been actively encouraging states to seek approval for reimbursement for school-based mental health services to Medicaid-eligible students under current rules and regulations. At this time, 17 states, including Indiana, Kentucky, and Michigan, already receive reimbursements for services provided to Medicaid-eligible children without IEPs, and with additional 9 states in the process for getting their state amendments under review. Again, Ohio is not one of them. The Office for Civil Rights enforces Section 504, or 504 plans as we know them in education, and is in support of expanded Medicaid-eligible services for all students. The quotes highlighted here are from an ERIC publication discussing education and the impacts of COVID-19 on America's students. I'm going to move into risk, gaps, and opportunities. Consideration for the work needed was highlighted within the executive summary and divided by short-term and long-term goals that were considered by examining potential risks, gaps, and opportunities to expand school-based services. Short-term goals focused on working on our random moment time study percentage, which from the time that we presented in 2022 has increased by 13%. Yay. I'll talk a little bit more about that and the work that we do with a steering committee. We also focused on Medicaid eligibility rate, and that is unchanged due to extended insurance coverage timelines in Ohio. I'll refer to that in a little bit. Medicaid administrative claiming funding. Again, there's no change with that because the state of Ohio doesn't allow our schools to claim all of our administrative work that we do with regard to Medicaid at this point in time. But under the school expansion for Medicaid, we could. Transportation reimbursement. We did a project overview that I mentioned a little bit with Lean Six Sigma with transportation. However, with the pandemic and the fact that we had a bus driver shortage, we had to condense routes, and those routes have to be separated for them to be Medicaid reimbursed. And with those routes being combined, we weren't able to recoup some expenses. So that's on hold, but we definitely want to look at that in the future to make sure that we get that back on track now that our staffing is pretty stable. The long-range goal that we looked at 12 plus months, so we're in year 2, that was finding ways and/or opportunities for lobbying state agencies and legislators as necessary to take advantage of other funding mechanisms provided by the federal government and available to states to expand Medicaid school-based services for administrative claiming, and I'm just mentioning a few, not limited to, delegated nursing services within schools to expand that, personal care services, and what that may involve or look like, and taking a closer look at the random moment time study process for Ohio and that documentation and the way that the guidelines have narrowed that down to a shorter turnaround of a time of responses for our service providers. The good news is, with these long-range goals in mind, a steering committee was created to address these areas by bringing local education agencies together to be a collective voice in advocating for expanded school-based services. I will be sharing additional information about this in just a minute. Next up, we'll divide into risks. I'm not sure, Mr. O'Connor, if you would like for me to share those risks, or
Right ahead.
you want me to go right ahead? Okay. It's important to have opportunities to connect with existing internal departments, the Ohio Department of Education, the Ohio Department of Medicaid, and monitor the eligible services that are not getting tracked and or billed efficiently, such as audiology and transportation, as I mentioned before. Since 2003, our third-party vendor for Medicaid healthcare billing systems, or HBS, provides district with reports that shows services provided and not able to be reimbursed for various reasons, such as no signed parent consents on record, students who are not eligible and or not Medicaid insured, services not documented by service providers, and the random moment time studies that are not completed by federally set deadlines. To date, no team exists to conduct an in-depth analysis for tracking departmental RMTS, for participation and or timeliness, tracking case management with regard to reimbursable documentations by service providers within each department, monitoring the eligibility rate that can potentially drop significantly without efforts to develop partnerships with Franklin County Jobs and Family Services to communicate the need to provide support for families to maintain current Medicaid insurance coverage. There are projections from ODE and CMS that range between 10 to 30% in reduced final settlement claims from our Medicaid reimbursement if nothing is done to ensure that Medicaid eligibility is a status and that students are insured. This hinders efficiency and could fail to maximize our Medicaid reimbursements. In April 2023, just recently, states began the process for ending Medicaid insurance coverage for people found ineligible. They have been automatically renewed post-pandemic or whose redeterminations can't be completed for procedural reasons, better known as unwinding. I'm not sure if you've heard that in the media. Columbus City Schools could be a resource in concert with community agencies to help our students and families obtain active Medicaid insurance coverage that could yield a positive effect on long-term Medicaid eligibility rates for the district. Here is a snapshot, and the next one, it should have 2023 state timelines. I took a snapshot of state timelines initiating unwindings related to renewals as of June 2023. As I mentioned before, that there is automatic renewal for everyone right now, so our eligibility status has not changed. However, that is about to change. That timetable, if you think about it, if it was set in May, 12 months is due to expire May 2024 this year. But there's some good news. Next slide. When you look at getting student families signed up for Medicaid, due to internal meetings and discussions with central enrollment colleagues, communications are being shared with new families to the district and now serve as a reminder to re-enroll for Medicaid insurance. But there's still work that can be done for students and families already enrolled in the district. Next slide's going to talk a little bit about gaps. There's no denying that opportunity gaps exist in education. Expanding funding and resources is key to closing opportunity gaps. Not only are funds and resources being made more available, but more attention is being paid to how funding affects schools and students, so states can identify the districts and learners in need for further support. Since schools are primarily providers of education-related activities, the school setting offers a unique opportunity to enroll children in Medicaid and facilitate access to coverage, as well as provide health services directly to any Medicaid-enrolled child. Schools provide a venue to enhance early identification of health needs and connect students to a broad range of health care services, including behavioral health resources. Specifically, school-based service providers can help promote health and education and educational equity and increase school attendance by helping eligible students enroll in the Medicaid insurance program, connecting students' Medicaid-eligible family members with Medicaid health coverage to support wellness plans, providing services that reduce emergency room visits, which is preventative care, as we all know, if you're insured, providing Medicaid-covered health services in school and seeking payment as a district for eligible services furnished, continue offering services that support at-risk Medicaid-eligible students being served within an IEP, which we already do, and providing services and performing Medicaid administrative activities to improve student wellness that promotes healthy environments and learning opportunities, and as we know, healthy students can improve the student attendance here at school. So the next slide, tipping point for school Medicaid expansion. So what can be done? CMS has extended the opportunity for school districts to bill Medicaid for all health services provided to all Medicaid-enrolled students, instead of being limited to the reimbursement for services included in a student's individualized education plan, or IEP as we know it. However, many states have been slow to leverage this opportunity because the original restrictions have been embedded in state policies that will need to be amended. Since schools have the potential to receive additional sustainable Medicaid funds to support physical, mental, and behavioral health services for more students by reinvesting in school health services, this additional funding could assist with covering a portion of the salaries of reimbursable Medicaid-eligible staff, thereby benefiting all students. Considering that CMS has released federal school Medicaid guidance in support of making it easier for states, school districts, and education agencies to expand school-based services, districts can advocate for serving in the best interest of all children in Ohio. Some opportunities, there is a bright side. There is technical assistance provided with technical assistance centers that are available to support state agencies, state education agencies, local education agencies, and other school-based entities with expanding school-based health services. I will be able to share at a later time web links for a lot of this information as well if you'd like to look at it. There will be grant funds available. In fact, actually, I think it's available now that are extended to states to make amendments with their state plans. A lot of people refer to them as a SPA, a state planned amendment that you may hear. As was shared during the National Alliance for Medicaid in Schools, it's called NAME, a conference in October in 2023. There were CMS representatives that communicated directly that states have been challenged to comply by 2026, thus changing how school Medicaid programs will be managed across the board. They are looking for this to be a national change and movement. So Ohio is still in conversation about it, although there have been a lot of changes, as you know, with the Ohio Department of Education. Now it's and workforce, and the Ohio Department of Medicaid recently announced their new person that's going to focus on school Medicaid. So we've had some gaps there, but fortunately everything is coming together just in time. So the next page, I have a snapshot of active attendees for the Ohio Medicaid Schools Program Steering Committee that came out of our project overview of how are we going to accomplish the goal that we set. So that's part of our long-range plan to be a voice in advocating for expanded school-based services. Active attendees include, as you can see, Columbus City Schools, Cleveland Metropolitan School District, Cincinnati Public Schools, the Ohio Department of Education, third-party vendors, and I say vendors because HBS, the representative for Cleveland, representatives for Dayton are part of this as well, so we have different demographics. They also serve rural schools and suburban schools, those third-party vendors, as well as the vendor for the Ohio Department of Medicaid, SOLEX. They do the random moment time study that's a part of our committee, as well as we have the Ohio Health Services Association Executive Director and Director, as well as a representative from the Children's Defense Fund. There's also, I think in your packet, a one-pager that the Children's Defense Fund is advocating for school-based expansion for Medicaid. The vision of the committee is to advocate for expanded school-based services in Ohio as similar to what other states are utilizing to facilitate and improve access to qualified healthcare services and improve the health of all students. Our committee is dedicated to the maximization of school-based Medicaid funding to support the tenets of Ohio's whole child framework for comprehensive educational systems where each child is supported, challenged, and encouraged to reach their full potential, and that's our mission. All right, the next one, A Tale of Two States, Ohio versus Michigan. How many people are football fans? Unfortunately, I am a spectator. I'm not really all into the sports because I went to schools down in southwest Ohio, but I'm on Buck's side. But I have handouts here for you. If you notice, there's an Ohio handout and a Michigan handout. So the reason I say A Tale of Two States, as mentioned earlier, 17 states have already expanded Medicaid payments for school-based services. Take a look at Ohio's plan, and then take a look at Michigan's plan. What are your thoughts?
This is a one-pager, and this is a packet, so.
Yeah, well, I do. What's up with that? Ohio has not amended their plan for school-based services. Michigan has. That's the difference. So when you see how it's clarified, it's spelled out, it includes a lot of the services that Ohio doesn't, they are able to be reimbursed for services aside from an individualized education plan, and we are not. So something to think about in terms of that advocacy. So, next one, current reimbursement. Maintaining the status quo. It's important to note that IEP those with IEPs will continue to enable the district to be reimbursed for services provided contingent upon being Medicaid eligible. As soon as that unwinding hits and they actually set a firm date, unless they decide to extend it again, we may begin to see one of the formulas that recoups our expenses, our Medicaid eligibility rate may drop. The unreimbursed, in order to proactively prepare for future school Medicaid claiming that corresponds with recommended legislative changes from the Centers of Medicaid Services, or CMS, the following areas within Columbus City Schools that could become a part of future consideration for administrative claiming coordination, such as central enrollment, school health services, community engagement, ESL or ELL, student support services expanded, IT supports, lobbying, and budgeting. So the next 3 pages, I'll kind of just forward through them, but I've kind of spelled out what that looks like in a snapshot for central enrollment, for school health services, for community engagement, et cetera. I'll give you a moment to kind of look at that. So the next page, moving forward, giving you a snapshot of what Columbus City Schools' total Medicaid school program reimbursements to the district looks like beginning in 2016 through 2022. And please forgive me, I forgot to put the decimal points in 00 under 2021 and 2022. I caught my own error, so please forgive me. But if you see the progression, and we had a little dip, if you think about what happened in 2019, there was COVID. There was a lot of confusion about telehealth services. What are we going to do? What is that going to look like? How are we going to document, et cetera, et cetera? So that is our dip, but we don't have a significant dip. In fact, we have steady increases when you look at it, because that eligibility rate, that unwinding hasn't taken place. So pretty much everything is on hold and is in place, but things are going to change and change rapidly. So I have more detailed information if you have more questions about it from Healthcare Billing System that does a good job of breaking it down in detail. Also, I forgot to mention, I think the details are in your packet, I believe so, that you have a total MSP reimbursement so that you see that whole snapshot and explanation from Healthcare Billing System. And also included in your packet, and I did breeze over that, are handouts from our most recent steering committee minutes so that you can see the work that we're doing on that committee. So in closing, by having a dedicated group of people, as I opened, with a dynamic leader charged with staying on top of the shared processes, data from our vendor, changes in the laws, lobbying on behalf, and training, and the training of staff will help the district maximize Medicaid funding and enhance the number of student families benefiting from Medicaid insurance, health and wellness to support the district's whole child focus. Again, CMS is expecting all states to have amended their plans to expand Medicaid reimbursable school-based services by June 1st, 2026. Unless they extend that, are we ready to embrace this change? So, with all of that said, that was a mouthful, especially if you're hearing it for the first time. I am open for questions, comments, discussions, etc.
Quick question, in comparing the two states, Ohio and Michigan, is there is it totally legislative from a standpoint, being able to offer more services? Or is that something to be done internally from a school system?
The school system could be an active voice saying that, hey, we have interest in expanding this because, as you know, legislators 9 times out of 10 aren't educators and they really don't know what the needs are in the schools or the current climate aside from what they hear on the news. So it is in the hands of the legislators right now to make that decision. I believe it was it House Bill 33 that kind of dropped like a lead balloon, that they began the conversations and then it got paused again. So this steering committee, if you notice, we do have, don't know a little bit about Brian Williams' background. He is a lobbyist that is interested in advocating on behalf of the Ohio School Health Services Association. Cleveland Metropolitan School District, interestingly, had 2 lobbyists in support of this Medicaid school expansion. So again, by bringing the local education agencies together and hearing who's doing what to what degree, how can we be a collective force to be able to speak up and speak out? There have been letter writing campaigns that have gone on with every other association. I'm like, hey, how come you're not asking schools to be a voice? So these are all things that I'm attempting to learn and understand. It's a little challenging, in all honesty, because my primary focus is with the Psychological Services Department. And this was a project that was really answering the question, to what extent are we leaving money on the table? And 2 years later, I'm still digging deeper and deeper. So that was a long response to say yes.
Okay, well, thank you.
You're welcome. Any other questions, comments, or discussions?
I'd just like to offer kudos to Dr. Floyd for staying with us, and she is really instrumental in creating the steering committee and how well-rounded it is. So kudos to you, Dr. Floyd. Thank you.
Thank you. Thank you for your time. Appreciate it.
All righty. I'm Dr. Floyd and Mr. Brown. I don't want to keep you any longer than you want to be here, so you feel free to leave if you need to.
Thank you.
Next, we'll get into the Office of Internal Audit. This, Terry Burchek from our office is going to do the next one. This is a audit follow-up, and periodically we schedule audit follow-ups to review the progress that management has made regarding the recommendations in a specific audit report. So she'll take you through the student attendance audit. Terry, I can turn that over to you. Have a seat right here.
Slight transition. All right, and we also have Dr. Klein on Zoom, who is also joining us for this presentation, and I have Dr. Corey Grubb with me as well. So I will start off by saying good afternoon, committee members. This is an update on the student attendance audit from fiscal year 23, and it was submitted to the board in June of 23. Primary rationale for high-quality attendance data is a relationship between student attendance and student achievement. Attendance is also directly related to the district funding and the district report card. Before I get into the detail, I'd like to thank Dr. Elizabeth McNally from Whole Child Support, Tyree Pollard from Attendance for Whole Child Support, and Dr. Michelle Klein, who is joining us on Zoom from Student Services and her team, and then Dr. Corey Grubbs transformation leadership and his team. We were able to work with management to validate and close 5 of the 10 issues noted, one of which was a repeat finding. From the one-page summary that you see, we have 5 remaining open issues. From the one-page summary, there's 3 issues that are in there. The first one is issue 3. Management does not have a process in place to ensure governance and guidance is consistent with current laws, rules, and regulations. And that is a moderate risk issue. The status of that particular issue is Dr. McNally's team has set up a new process to periodically review the guidance. They have a new completion date of August of '24. So Office of Internal Audit will follow up with that particular issue at that time. The next issue is issue number 5, the absence intervention team formation, including all required members and documented attempts to notify the students, parents, guardians, and a student assignment is not occurring timely. It's occurring, just not timely. And that was a moderate risk issue. The status of that particular issue is this recommendation recently transitioned to the transformation and leadership team from Whole Child Support, and we are working with Dr. Grubb's team to resolve the noted issues. And then issue number 6, which is the last one from the one page, the absence intervention plan creation is not occurring timely, and that is a moderate risk issue. And the status of that is this recommendation recently transitioned to the transformation leadership team from Whole Child Support, and we're working with Dr. Grubb's team to resolve the noted issue. The remaining 2 open issues are repeat findings, and they consist of the absence notification letters sent to students, parents, and guardians are not occurring timely, and that was a low-risk issue. The status of that one at this point is the recommendation recently transitioned to transformation leadership team from Whole Child Support, and we're working with Dr. Grubb's team to resolve the noted issues. And the final open issue is also a repeat issue. The school administrators are inconsistently utilizing the monitoring and oversight reports noted in the District Administrative Guideline AG 5200A, verify proper attendance coding and correcting attendance data errors. That is a moderate risk issue. And again, this recommendation recently transitioned to the transformation and leadership team from Whole Child Support, and we're working with Dr. Grubb's team to resolve the noted issues. Before I turn it over to any questions, I'd like to go ahead and turn it over to Dr. Klein for her to make some comments, and then to Dr. Grubbs for him to make some comments, and then I'll take it back before we address any questions from the committee. Dr. Klein?
Thank you, Terry. I appreciate that. For all of you that do not know, I'm on vacation, but I felt this was very important to attend. So thank you for tolerating me being on Zoom today. First thing I want to say is the process and procedures that are already established and are already there, it is not easy to get a whole school district behind those. We are working very hard, not only Whole Child, but transformation and leadership. We're working together. Student assistance is here to support them whenever possible, not only with the procedure, but also in IC, so in our student information system, Infinite Campus. So we will work very hard to make sure, especially that Dr. McNally reaches her goal with regard to August of 2024. And then with Dr. Grubbs and Transformational Leadership, I'm so proud that they are taking this on and being willing to work on this to make things better. So I see nothing but improvement from here on out, and I want to thank everyone for their support. Thanks, Terry.
Thank you. I'll turn it over to Dr. Grubbs.
Yeah, just want to echo the same thing that Dr. Klein said. These are new things we've been taking on. We've been working on a weekly basis with Terry and her team to resolve some of these issues as well. We're going to be doing some we meet with our principals on a monthly basis, so we'll certainly be bringing these issues to their attention, doing some training with them as well to continue to resolve these issues. And so just want to continue to appreciate the partnership that we have and thank everyone for their support as well. So thank you.
Okay, thank you very much. And then before I turn over to the committee for any questions, I do want to do a little reminder that I do have a hearing loss. So I need you to speak good into the mic so that I can, hopefully the volume will be up a little bit and I can go ahead and catch what your question is. So are there any questions or need any clarifications?
Well, thank you for the report, and I'm trying to speak really loud because my voice is really low. Dr. Grubbs, this question is for you. I know this is just being transitioned to your department. Do you have like a timeline or some benchmarks that you are able to share at this time, just in terms of, I know you mentioned meeting with the principals, but essentially what is your strategy to being able to close these particular issues?
Yeah. So the first thing we'll do is we're going to, sorry about that. The first thing we're going to do is we're going to do some work with our area superintendent and principal coach team. We'll cascade with them first, and then at our March admin update meeting, where we meet with all principals, assistant principals, and other folks who support schools, we'll bring this to their attention and do the training and list out expectations with them as well. And then we'll have a monitoring system where the area superintendents and principal coaches will be monitoring the principals to make sure that those tasks are completed and carried out. And that's how we do our checks and balances. So the principals will get it, at the March admin update meeting.
And Dr. Grubbs, I guess just to add on to that, then, do you foresee needing any additional support or investment? I know you mentioned the trainings, but do we have the infrastructure to be able to support the changes that are needed in this particular area?
Yep, absolutely. So Dr. Klein and I will continue to work together, and Dr. McNally, and so we have the resources and the internal folks in-house to deliver the training to the principals. So we have it in-house. It's just a matter of us coordinating our efforts and working together to get the task completed.
Thank you.
You're welcome.
Any other questions? Yes, Mr. Jordan.
I'll try to speak loud too, Terry. Is that good? So on issue number 3, I guess I'm trying to understand what should be driven by management to be in compliance with the laws and regulations, and what maybe Mr. Barnes' department should be pushing out to management. Here's some changes in regulations that you should be aware of and update policies. Is there coordination there?
Yes, absolutely. So, yeah, there is going to be a coordination with Mr. Barnes, with legal, and with other stakeholders.
And then second
And
question.
I was going to say, part of the thing to add to that as well is that's kind of where we had some of that transition with some of the issues, is first was trying to get that foundation and exactly what the requirements were. I mean, House Bill 410, when that had changed, we were delayed in getting some of our guidance updated to coincide with it. So now that that has been resolved, it is now getting to the point to make sure that it's being executed with fidelity throughout the district, which is why we now have some of the ones that transition from whole child to transformation leadership.
Just maybe to help me understand, so when a student gets referred to the absent intervention team, what is timely notification? Would that be same day or next day?
It's statute, and let's see, which number was that issue?
5.
5? Okay, that particular one, it is, I think it is, see. They have to be assigned to an absence intervention team within 10 calendar days of the trigger event. And the trigger event is whenever they are deemed to be, with a chronic absenteeism. So once they hit that trigger by statute, it has to be a calendar day. And then from there, it goes into when they're on the team, there's certain items that have to be done. There are a couple of those, I think, are like 7 days from that point. So it's all set by statute.
Thank you.
And I'll just say the last piece with the training and monitoring. We have several veteran principals who have this process down. It's the newer principals to the district. We have several first-year principals that we have to, train, remind, monitor, and sometimes even model the process for them as well. So as I'm thinking about it more, it's the newer principals we have that we have to really work this process with.
Great, thank you.
Yeah.
Terry, it's Michelle. Can I add, please?
Go ahead.
Yes, Terry, I just wanted to add to that question that our student data specialists work with the individual teachers and with the principals and with the secretaries in order to establish those timeframes. And so as soon as we update board policy and then make the administrative guidelines, then we'll be able to lay out those a little bit more clear for all of our principals. So we're excited to do that and get it done. We've been waiting quite a while. And Kyle Lathwell from policy and from our legal department is assisting.
Dr. Klein, which policy is that? Can you give me the exact policy number? If you have that. I don't know if this is working, but.
Which policy was?
The policy she says that she's waiting for the changes working with Kyle. I don't
The
see
Board
it.
of Education
Board policy 5200, the attendance and truancy. And that was issue
Yes,
2.
ma'am.
That was one of the ones we were able to resolve because that was finally updated. It was out of date
Okay.
for what the statute had stated, and it was using language that no longer was applicable. So that was where we were getting that set. And then from there, the next part is making sure about the administrative guideline. So we have the one administrative guideline, and it's not being followed with fidelity at this point. So it's a case of, is that still in play? And that's a good, valid administrative guideline. Then we need to go through and get the schools to go ahead and comply with it. If it's things that need to be adjusted, then those adjustments need done, and then having it recommunicated out. So that's the part
So
that we're
Board
working out.
President Vera, since the board policy is updated now, we'll be doing the administrative guidelines next month so that they're all ready for the principals that Dr. Grubbs was referring to his principal meeting.
Thank you, Dr. Klein.
Thank you so much.
All righty, thank you, Terry. Thank you, Dr. Grubbs. Dr. Klein, thank you. And please thank Dr. McNally and Tyree Pollard, because great work done here with getting 5 of the 10 resolved. So really appreciate that. All righty, the next issue is an audit report presentation. So we have safety and security audit report that will be presented by Dion Brown. An important point to note as Dion reviews this report is his comments relate to the effectiveness of the safety and security monitoring of safety drills. I'll turn it over to you, Dion.
Thank you, Kevin. Good afternoon, committee members. I'd like to go over the safety and security audit. Before we go over the audit, I would like to thank and acknowledge Mr. Baker and Mr. Green and their entire staff for their cooperation throughout this audit engagement. With that being said, if I could bring your attention to the audit at a glance document for the safety and security audit. For discussion purposes today, we will discuss this document. Note the full audit report has been sent to this committee, and you should also have a copy of the full report in your folders today. This audit was included as part of our FY23 audit plan. The primary focus of this engagement was safety and emergency evacuation drills, school emergency management plans, and the testing of those plans. As a result of our audit work, we noted 6 issues and developed 10 recommendations for improvement. I only intend on going over issues 2 and 3 today. However, we can address any questions you may have concerning any of the other issues noted in the report. Starting with issue number 2, non-compliance with safety drills in accordance with Ohio law and Board of Education policy, a risk rating of moderate. Ohio law and Board of Education policy requires the district to perform school emergency evacuation drills and safety drills. The Office of Safety and Security has developed a monthly schedule of required drills in accordance with Ohio law. The schedule requires all drills to be entered and logged into Navigate 360. Navigate 360 is an emergency management system that is utilized by the Office of Safety and Security to manage documentation and emergency operation plans, including the scheduling and logging of safety exercises. Please see page 2 or appendix 1 for detailed results for our testing in relation to issue number 2. I will highlight a couple of the results based on our testing. After reviewing the schedule of required drills by month, it was determined that from August of 2022 to December of 2022, each school should have completed a minimum of 11 drills, 5 drills for evacuation, 5 drills for lockdown, and 1 reverse evacuation drill. Between August of 2022 and December of 2022, 34 of 116, or 29%, CCS schools failed to record 11 required safety drills in the system of record. 52 of 116, or 45% of schools failed to record 5 required emergency evacuation drills in the system of record. and 75 of 116, or 65% of schools failed to record 5 required lockdown drills in the system of record. With corresponding recommendation for issue number 2, the Office of Safety and Security should improve their monitoring process with schools timely documenting drills in the system of record, Navigate 360. The Office of Safety and Security should instruct schools to enter their active shooter drills as active shooter drill and not a level 3 lockdown drill. Are there any questions for myself or Mr. Baker concerning issue number 2?
Mr. Jordan.
Maybe just for clarity, Dion, did the drills occur and they weren't documented, or how can we evidence that the drills actually occurred?
We actually didn't go out to the site. We were evaluating the effectiveness of safety and security's monitoring. Per their procedures, all drills are required to be scheduled, logged, and posted within Navigate 360.
So we feel good that they did occur, just didn't make it into the system.
That is correct.
Okay.
Thank you.
Okay, moving on to issue number 3, noncompliance with notification of safety drills to the appropriate state and local officials in accordance with Ohio law and Board of Education policy, a risk rating of high. Ohio law and Board of Education policy requires the district to notify the appropriate officials of each safety drill. Our office was unable to obtain any evidence of notification or submission of scheduled exercises or drill logs to the appropriate state and local authorities during our audit. The school safety platform, Navigate 360, has the capability to send email notification of drill logs to the appropriate state or local officials if building administrators timely schedule and post drills. With corresponding recommendation for issue number 3, the Office of Safety and Security Management should develop a process for notifying state and local officials of required drills. Safety and Security Management should develop a monitoring process to ensure drills are timely scheduled and documented in Navigate 360. Are there any questions concerning issue number 3?
Just who are these notifications going on? You say state and local officials. I mean, who are they?
The police chief.
Is that fire department?
Fire department.
The state fire marshal as well.
And do they usually have some kind of response to that, or is it just a requirement that they be notified?
Yes. Okay, on page 3 is Appendix 2, where our office performs some follow-up monitoring over safety drills scheduled and completed. We also performed some follow-up over school emergency plans completed and tested between October and December of 2023. If there are no other questions, Madam Chair, this concludes the overview of the safety and security audit.
Anyone else have any questions?
And there are a few wordsmithing edits that we would like to make, just to make sure it's clear, as Mr. Jordan had pointed out. This is not about the drills taking place, it's about the monitoring and effectiveness of the reporting system for the drills.
That is correct.
So as we were going through it, I noticed a couple areas where I can make that a little clearer, so it won't change anything in the report, but it's just going to make that clear.
I think that's a good idea, Kevin, especially as this becomes a public document.
Correct. Very much so. Absolutely. So we will get a vote on this to release and move this ahead to the board. So if I have a motion and a second.
So moved.
I'll second.
All righty. Ms. Vera?
Yes.
Mr. Grant?
Yes.
Mr. Bajan?
Yes.
Mr. Jordan?
Yes.
And Mr. Daniel?
Yes.
Motion carries. Thank you, Dion. Thank you, Mr. Baker.
Thank you.
Okay, now we'll move into the follow-up update. And really, I just wanted to go over one thing in this space. It's the risk acceptance process. I had included a completed risk acceptance document in your packets. It involves an IT issue, so I'd rather not talk about the issue here, but I thought you'd get better context if there was information in those boxes. So not that I need your feedback now, but if you want to review that and let me know if there's any issues. We developed procedures for this process whereby management can accept the risk associated with a documented issue, and then it will come into our office and the CAE will review their information and make sure it fits what it should. And then the CAE will either agree with that can be accepted given the compensating controls, et cetera, or if not, we'll circle back with management to explain why it shouldn't be. If there are no objections to that part of the document, we'll forward that to the committee just for review and comment. So again, if you get one of these and you have concerns about it, let's have that discussion. And again, you can email the CAE, myself right now, but just to talk about that. So that was the process. Once it's forwarded to the committee, if there are no comments, it gets on a list. And then annually, we would review that accepted risk with the department management. Because we may have people, key leaders that change, we want to make sure they're aware of that risk. They're still comfortable with the steps taken by the previous manager. So that was the process. And then we did a pilot, which again, that's the completed form that you have. We worked with Dr. Brown and his staff to make sure the process was functional and efficient. So he had no concerns. So this is the process. And again, if you have comments, that's fine now, or if you want to email me, that's fine also, before we formalize it, and then we'll start using this as we go out and talk to managers about their risk. If they have things that they want to accept, we'll process it with the form. The other piece of the follow, I'm sorry, were there any questions with that? And then the other piece of the follow-up is going to be covered in the dashboard, and that's the numbers of outstanding follow-up comments.
Kevin, I guess one small question.
Yes.
Is there a level of risk or a type of risk that would warrant the superintendent's awareness?
That's a good call. We had not considered
Or something that would go to
yes.
the cabinet? Just, that's the one thought I had. I like what you did. It's just very good.
Okay.
I agree. Good call on that.
Yes. So we will work trying to develop that and get back with you on that. The next item is the Office of Internal Audit Charter. We sent out the OIA charter document to you. The current OIA charter was revised and adopted by the committee and subsequently approved by the Board of Education on September 20th, 2022. I wanted to get this document into your hands also, but since we don't have a full committee yet, we're not going to take any action on this, but you can look at that and forward any comments you might have. Again, when we did that, we tried to align that with the IIA standards to make sure we were compliant with that and had everything addressed.
Just one thought. I might recommend that you or someone on your team take a look through the new global internal audit standards. And we're having to make quite a few changes to our internal charter and the board charter. So that might be in other areas. So that might be a worthwhile exercise.
Thank you very much. We will do that.
We have time because they're not effective. They were published on the 9th of January. They're effective January 9th of 25 to be in place. And it will take additional actions, Ms. Vera, by the board and by the committee.
Thank you.
Awesome. Next item is to confirm organizational independence. Organizational independence is effectively achieved when the Chief Audit Executive reports functionally to the board. Some examples of functional reporting to the board involve the board performing these functions: approving the IA charter, approving a risk-based internal audit plan, approve internal audit budget and resource plan, receiving communications from the CAE on IA performance relative to the plan and other matters, approving decisions regarding the appointment and approval of or removal of CAE, evaluating the CAE, and making appropriate inquiries of management and CAE on the existence of inappropriate scope or research or resource limitations. So we are free from interference in determining the scope of internal auditing, performing the work, and communicating the results. Any interference will immediately be reported to the committee and the board, and we will discuss the implications from there. So currently, I can confirm organizational independence of the OIA. Next item is OIA staffing plan. We had the 2 senior segment manager positions open last time we met. They were filled by segment managers currently that were within OIA. So we've started trying to backfill those 2 positions. We do have an additional senior segment manager position that's been posted. and we'll keep you up to date on how that process is going. And also, Kevin Sanskowski has submitted his retirement paperwork effective January 31st, so just a few days. His contributions to the Office of Internal Audit have been awesome, and his knowledge and skills will definitely be missed. So thank you, Kevin. Fiscal year 25 OIA budget. The budget will remain the same as last year. And then if additional resources are warranted or needed, we'll have discussions with the board, superintendent, and treasurer to see how those resources can be obtained. WCBE audit report. The audit report, normally we just verify that it's been completed at this stage of A&A meetings, but an extension's been granted to the external auditor through February 13th of 2024. So given that that hasn't been released yet, we'll keep that on the agenda for the March meeting. And then the last thing is the dashboard, which I will go over, but are there any questions on any of that information that we just went over? All righty, and now we'll go over the dashboard. Page 3, we'll start there in the audits area of the page. You'll see 2 audits are complete. That's an increase of 1. And we're working with management on both of those to obtain their responses, and then those will be routed to the committee. 6 audits are in the fieldwork stage. That's an increase of 4. And corresponding 3 audits are in the planning stage, and that's a decrease of 4 because those 4 moved up into fieldwork. In the project area of the page, 2 projects have been communicated to the committee. 1 project is in the fieldwork stage. That's the risk assessment. So that's an increase of 1. And 2 projects are in the planning stage. So on page 4, we requested that the food services be added as an audit during our last meeting, but as you heard from Mr. Brown today, we're collaborating with him to help him. And I think, Mr. Grant, you had the great comment that if we were involved in that implementation up front, and we weren't, but when we reached out, we didn't realize the project was running behind, so we get a second chance or bite at that apple. So we're going to take that and help him any way we can. So I really like the committee to make that an agile audit as opposed to a regular audit. That way we can have limited scope, real-time results, and frequent communications with him instead of, making it a long, drawn-out audit. Page 6, 7, and 8, those are the Gantt charts. It was basically the same as last time. I had to move some of the stuff with some things that were happening in the office. So you'll see the only change is on some of those pages, you'll see an orange arrow that did indicate when we would bring that to A&A. Some of those are now orange arrows with diagonal lines in it, and that just lets you know that we moved that from 1 month or 2 months out to a different month. Just so that way you don't have to sit there with 2 reports and compare. You can just look and know that that was moved. Page 10 is the current status of open recommendations by department. So OIA ran an updated follow-up report from our teammate software on January 18th and compared that to the status report presented at the October A&A meeting. The current report includes 223 open recommendations, which is down from 270 that was shown during the October meeting. So that shows that 47 recommendations were closed since October, and 10 of those were high-risk items, too. So kudos to management and the OIA staff for diligently working with management to resolve those issues and make excellent progress. Page 11 is the current status of external audits and reviews. We currently have active projects for the first 3 reviews listed on the page, and then we have an OIA team member working with the IT staff on the penetration testing item. Then page 13, just a couple highlights to this. Kevin Sanskowski was asked by the Council of Great City Schools to present a risk alignment project at their conference for purchasing directors, risk managers, and internal auditors. That was in November of 2023. And again, it was just nice for them. It was a project Kevin had already done, but somehow they got wind of it and really wanted him to come present that. So that's fantastic for them to be asking us to do things like that, so. And then we were able to locate 2 trainings related to district subject matter, which is really in one of our goals to try and get up to speed on district operations a little bit better. We're actually looking at professional development days as that's scheduled throughout the district. That's a day every month where district staff will be taking professional development opportunities in-house, or they can bring in a speaker. So if we see things that are relevant to our work, we're going to jump on that. And even if it's not currently relevant to our work, it might just be helpful to expand our knowledge by doing that. So just let you know that that is taking place. Page 14 and 15, just to go over a couple things. OIA Path of Excellence, we continue to have great meetings and great discussion with board members, leadership, management, everyone throughout the district. So that's fantastic. The interim internal auditor expectations, we developed Board of Education goals with the assistance of Ms. Beckerly and Ms. Vera back in November. Thank you. And thank Ms. Beckerly also for that. We reviewed those goals with the Board of Education, and I have quarterly check-ins with them to make sure the progress is continuing as it should. So my next check-in is April 9th. Some OIA enhancements. I think if you recall, last time we met, we had talked about a workspace where we can, instead of you getting an email with 11 attachments, we're going to put all those out into some workspace. We'll send you an email to let you know that it's available, and then you can go out there and access that. It's going to have old audit reports on it, old dashboards, things like that. We're real close. In fact, kudos to Carolyn Edwards back there. She's been spearheading that project for us. But we just want to check out some access issues and some security measures to make sure it's not accessible by everybody once we open it up. So once we get those taken care of, I'll be reaching out to the committee members and having you access that to see what you can see. And I'll have some others also trying to access it from outside our group just to make sure it is locked down to just our group. So that's one thing. We've contracted with a vendor to assist us by enhancing our audit reports and routine communications. You know, we want to make the reports easier and quicker to understand by adding charts, graphs, and some concepts that have been proven to work in other audit shops. So we're trying to get away from those 12-page audits and get that condensed into 3 or 4 comprehensible issues. And then the other contract we have is with a vendor to assist us in 3 main ways. The first one is to provide the Board of Education with analysis on the proper reporting structure of OIA. Do they see the need for OIA to still report directly to the board, or is there some other arrangement that's out there in the environment that we're not aware of that can still maintain independence, et cetera? So they're going to help us with that and do a report, and they'll report that to the board. The second item is they're going to provide OIA with audit and non-audit services when gaps arise due to staffing, or there's an audit where we need expertise and we don't have it in-house. We're going to utilize them. And then the last thing we'll do with them is they're going to provide us assistance in assessing the quality of our work, especially with the first engagement every year. They'll go through and make sure that we're compliant with the standards that we require, just to make sure we're not missing anything. And that way, by doing it with the first audit out the door, if there is a gap, we can correct that gap and we don't repeat that throughout the rest of the year. And then page 17 is our table of organization. Again, blue indicates currently vacant, yellow indicates leave, green indicates to be posted, and then the gold indicates retirement. I'd be glad to take any questions you might have.
Do you need an action to approve the change?
I do.
Plan?
Yes.
Okay.
We'll take a vote. All righty. A motion and a second, yes, please.
I'll motion, approve the change in the plan.
All righty. Ms. Vera?
Yes.
Mr. Grant?
Yes.
Mr. Vajon?
Yes.
Mr. Jordan?
Yes.
And Mr. Daniel.
Yes.
Motion carries. Madam Chair, that is all I had today.
Wonderful. Does anyone have any questions or final thoughts before we adjourn today?
I appreciate this is the one-page summary at a glance.
Yeah.
It's really good.
Yeah.
So thanks to all the team who pulled that together. This is very helpful.
Yeah, I agree.
Glad to hear it. Thank you.
We good? I just need a motion to adjourn.
So moved?
Second?
All right, I'll call the roll. Ms. Vera?
Yes.
Mr. Grant?
Yes.
Mr. Vajon?
Yes.
Mr. Jordan?
Yes.
And Mr. Daniel.
Yes.
Motion carries.
All
Thank you
right.
very much, everyone.
Thank you all. Have a great evening.
Kevin, congratulations on